Good morning. I'm Dr. Angela Meridian from the Meridian Smile Boutique in Syosset, 175 Jericho Turnpike, Suite 108, Syosset, New York 11791, and our phone number is 516-364-1444. You can also reach me via email at drmsmiles, drmsmiles@optonline.net. I was sitting in traffic here, and I thought, let me do a quick video. I apologize for the unprofessional nature of the video, but I was just sitting here thinking about certain issues that kind of come across, I come across with patients in the office. And what I wanted to kind of get into today is TMJ, what the causes are, the treatment, and some of the things that patients go through with TMJ discomfort. TMJ stands for temporomandibular joint, and what it is, it's a joint that everybody has. So when people say, I have TMJ, it's a little bit of a calling it, because really it's TMJ discomfort or pain, or TMJ disease is the name of the pathology, the discomfort that people will sometimes have. So it's called TMJ pain. Otherwise, everybody has TMJ. Everybody has two joints. So therefore, when you call it, I have TMJ, it means that you have two joints, which doesn't mean that you have pain. Now, if you're having pain, you know, again, what is the cause of all this? And it's a very difficult thing to pinpoint. It is multifactorial. There is some genetic component to it. But what causes pain around the joints, the two temporomandibular joints, one here, is 90% of the time it's actually muscular, and as such has to be treated in a way that a muscle has to basically be relaxed in order for this discomfort to go away. And there's different treatment modalities depending on what's going on. You can have a chronic situation, or you could have a flare-up, an acute flare-up, in which case you have to kind of treat it differently. The most conservative treatment is usually, but before I get into the treatment, let's think about what causes these TMJ discomforts and pains. And this is not meant to diagnose anything. You do need to go see TMJ specialists or your dentist who can treat this the best. But you know what? Some of the many things that will cause TMJ discomfort, the ones that are acute discomfort, which means flare up. And I apologize for all the horns here. This is a little bit of traffic situation here. But, okay, so again, the acute flare-up, that means you're not having pain. All of a sudden, your joint starts to hurt. You get pain around your ear, in front of your ear. It's just aching and it's hurting, and you're not sure what's going on. A lot of times people will think it's actually a toothache, when in fact it's not. Some of the root of all this problem with TMJ, when you do get a flare-up, it is stress-induced, we believe. It could be physical or mental stress, which causes the muscles to sort of tighten up. And the way that works is basically stress causes your brain to kind of produce these hormones and so forth. And it's allowing the brain to basically tell your muscles around the joint to squeeze your teeth together or grind them. One is called clenching and one is called grinding your teeth. So when you're clenching and grinding your teeth, what you're doing, in fact, is you're exercising the muscles, and it usually happens when you're sleeping. Now, when you're sleeping, you don't have control over this, and the force with which this happens, it's very strong. It's probably about 10 times the normal chewing forces. So as you can see, you now have a situation where you're exercising your muscles while you're sleeping through grinding or clenching. You're exercising your muscles about 10 to 20 times stronger than the normal chewing force. So what happens in those situations is you'll get a soreness, tightness of these muscles, and it's a normal, like you would get on your back, on your neck. Now you can get on your face, and it's very, very uncomfortable. And the way to treat those situations is, again, deal with the stress. A muscle relaxant is something that may help to relax the muscles. A night guard is made, in which it's like a little pillow that goes between your teeth, and you kind of relax your teeth that way. It's supposed to allow you to relax your joint. It separates your teeth ever so slightly. If your teeth are separated, the idea is that the habit will not go on. As well as a night guard can be made in your dental office by dental professionals, which will have to take an impression. It's a 2-visit procedure. It runs anywhere from $250 to $350. Your insurance may or may not cover it. It depends on your policy if you have dental insurance. And if you want to get something over the counter, I will tell you anything is better. So I would just go ahead and get something from the drugstore. It's called a night guard. You kind of boil it and make it at home. You kind of bite into it and you start wearing that for a few days. TMJ flare-ups, the discomfort, which is acute pain all of a sudden coming on, does not go away on its own. And it doesn't go away quickly. I will tell you, even with all the treatment modalities that we have, it takes probably a good month and a half to get this resolved. Now, in addition to this, obviously anti-inflammatories are very helpful. Tylenol, Advil, Motrin. It helps relax the muscles. A heat or cold compress is recommended. Now, I will tell you, heat relaxes the muscles, but the cold is good for the inflammation of the muscle. If you have a knot or something that's really just spasmed, or it's tight, it's a difficult thing. You kind of have to see which one is helping more. If the heat is helping, then I would do heat. If the cold is helping, then I would do the cold. But I would start with heat and then go to cold. And don't keep it on for too long, no more than 15 minutes. And again, soft diet, anything that will relax the muscles. No, not too much talking, yawning, anything that kind of stresses these jaw muscles here. It's a very difficult joint to relax, obviously, because it's your mouth. So how do you stop functioning? You have to eat, you have to function in society. And that's what makes the whole process so prolonged and so difficult. At times you have to deal with the cause of the stress, that's something that you may have to deal with. And I will tell you, sometimes people will have a toothache in combination with TMJ flare-up. If you have a toothache, maybe it feels better to bite on the tooth and clench it. So that sometimes will be the cause of the problem. And it's one of those things you just have to figure out where it's coming from. And your dentist, again, can help you figure that out. So this is where the acute flare-ups are treated, and I think I've covered most treatment modalities. There is also one final treatment that I've started to do in the office, which is probably the most effective, and I will tell you, it is pretty much within a day or two you feel better, which is the Botox treatments. Toxin is introduced, it's placed in the muscles right in here. Lasts up to 3 months. For an acute flare-up, it's nice because you can sort of make it go away. You could take it once and maybe you don't need it again in 3 months. If you do need it again, you do it again in 3 months. But this is the most immediate treatment that I have found for TMJ discomfort. Even the muscle relaxants, in my experience, haven't really helped as much as the Botox does help with TMJ pain. Then you have the chronic TMJ pain, which is just people who deal with this on a regular basis. They have a little arthritis or some muscle issues that are just so, it's become part of their life, which is a very difficult thing to treat. Those people, again, you can't even really introduce a night guard. I will tell you that makes it probably worse because you're stretching the muscles when you put the night guard in. So that is really something that has to be evaluated, and everyone is different with the TMJ treatment in those situations. And I will tell you, even those chronic situations, Botox has proven to be an amazing drug that just cures these chronic pains that people have, and it's amazing. Again, I'm not going to say every case is like this. You really have to be evaluated. Your teeth have to be evaluated by a dentist, your muscles and your whole jaw, and there's something called vertical dimension of the mouth, which is determined by the teeth, and the wear and the tear on the teeth. That has to be evaluated by a dentist as well. Which is why I feel dentists really should be the first people to treat TMJ discomfort. We are probably the most trained in and around the mouth. And certainly if you have questions and you think you have TMJ discomfort, you're not sure, or you've been treated in the past, you're not sure what's going on, it's not helping, you can always email me. I'll be happy to answer any questions that you may have, as much as I can over email. Obviously, it's again, it's Dr. M. Smiles at optonline.net. It's DRM Smiles, SMILES at optonline.net. Thanks for watching, and I hope that helps. Have a great day. Bye.